I'm Andrew. This is Dr. Hall, Carly Hall. She's a doctor of audiology. And Chris and Becky asked us, well, what would you like to talk about? And one thing that there are some new things and confusion and certainly is out there for all of us as we go on this journey of life is hearing loss, and then also that thing called tinnitus, or ringing in your ears. So Carl and I wanted to just share some thoughts about that, where we are scientifically and what can be done, and just kind of go through things like this. And the way I like to do this is that please ask questions. I do reserve the right to say, hold on, we'll handle that in a little bit, okay? But we'll go through things and just kind of talk about it. If you have difficulty hearing me or Carly, please let us know. I'll repeat it. But is everybody here okay like this? Is this okay? Yeah. So I like to start with this quote. I know some people say that silence is golden, but I think those people never lost their hearing. This is a 65-year-old lady that I had the honor of meeting when she had her cochlear implant turned on for the first time when I did some studying in Melbourne, Australia. And I've never forgotten that because she cried. She lost her hearing from meningitis. It was acutely, and she went from hearing to not hearing, and this was a great gift for her. But that, I've never forgot that quote, and it really, it's one of the things that motivates me to do what I do. So we hear this a lot. I can't hear. I can hear. I just can't understand it. And what about this ringing? You know, and they often go hand in hand. And we're just going to kind of talk about those things a little bit with that. So we'll talk about hearing loss, tinnitus. Sometimes they're combined. A lot of times they are. What can be done for them now? And then when we have problems, especially with hearing loss, and hearing aids don't work, what other options do we have? Tinnitus, in Latin means tinere, the ring or tinkle like bell sound. That's where it came from. It's an abnormal ear noise. It's perception of sound in the ear in the absence of an external source. So you hear it, but there's not anything making that noise out there, okay? There's two types we usually talk about. There's objective, which is very rare. That means I can put my stethoscope up there, or walking by or something like that. Someone else can hear that ringing you're having. That's extremely rare. What we usually go with is subjective hearing loss, where a person hears it, but no one else can hear that noise with that. It is a very common complaint. You know, 1 in 5 people, in about anywhere from 10 to 20, 15% of people, it's severe enough that it affects their quality of life. Okay, so it's a serious problem with that. In the veterans, it's #1 service-related disability. Okay. What are some of the causes we know about that we may be treating? Well, non-ear medications. Dr. Imperial can often go through that with you, and sometimes it's not one medication, it's a combination of medications with this. TMJ, temporal mandibular joint syndrome, your jaw joint is right next to the ear. That can be another treatable cause of tinnitus or ringing in your ears. High blood pressure, sometimes that can give, hypertension can give you the ringing in the ears. A brain injury is a common, we see that a lot with that. There's also a genetic predisposition for that. Sometimes it's just your genes. There's nothing you can do about it with that. Ear-related causes. Many people I've seen when they have the ringing, I get the wax out of the ear and the ringing goes away. I wish that was everybody, but it does happen once in a while. Not very often, but once in a while we're a real star because we just kick the wax and they think that's fantastic. A middle ear infection. That's a real common reason for kids to get tinnitus. I'll see kids and they'll be complaining of ringing. They're referred for that reason, and they have middle ear fluid, and so that can also happen in adults with that. There's a disease called Meniere's disease, which is usually a triad of episodic dizziness with fluctuating hearing loss and fullness in the ear. But ringing can be another one of those. And I always say it's a triad, but there's always more things that medical doctors can come up with and say that it's part of the syndrome with that. Otosclerosis is a hardening of those bones inside the middle ear bones. And so these are just common ones. There's other things that go along with this. By far, hearing loss, noise-induced and age-related. Again, age-related would come with the genetics, and noise-induced is like we think about our military, the veterans, that's why it's a #1 cause in there. It goes hand in hand with the hearing loss. Well, why? Okay, it's usually a combination of acquired hearing loss and a neural network, auditory or extra-auditory problems. What do you mean, Doc? We don't understand the full mechanism of how tinnitus happens. It's an ear problem and it's also a brain phenomenon. It's both, it's not just one. There have been studies on people that have had, because of a tumor or something, their ear resected, including the bone that houses the ear, and they still complain of tinnitus in that ear. So there's more to it than that. It's not just an ear phenomenon. Carly, anything you want to add to that?
Yeah, and also with that ringing, there's a lot of different research, kind of like he said, we believe it comes from some portion of the brain as well as the ear. A big cause that a lot of people will say that makes it worse is stress. The more stressed you are, the louder it is. I tell a lot of my patients that have and complain about that ringing, it's something like a self-fulfilling prophecy. You hear the ringing, you get angry about it, it's louder. So then you get even more angry about it, now it's even more louder. And it builds and it builds and it builds. And that kind of stress is what leads a lot of people to get very irritated and have very negative thoughts, because it's something that won't go away. It'll always be present. You just have to learn how to manage and live with it.
So, when we talk about the treatment, if I try and identify the cause, is it your medications? Is it something with that? Okay, treat the hypertension. Noise suppression, masking, hearing aids. We know that if you wear an appropriately fit hearing aid for 4 months or longer, it can dissipate and make that that tinnitus less noticeable with that. Anything you want to add on that part?
Yeah, and a lot of times the main reason on why we think it does is because you're actually having access to noise. A lot of times what some people believe is due to you having hearing loss, you don't have neural stimulation, which your brain goes, okay, I'm gonna make it for you. And there can be where that ringing comes from. With hearing aids, while you're wearing them, you have access to sounds that you may never have heard clearly in a long time, or you just haven't realized you stopped hearing to begin with. So a lot of times just having access to that extra stimulation really helps and kind of tunes it to the background. As well as noise masking and hearing aids, usually we recommend you doing it only when it's at its worst, because we don't like you to just rely on that masking. We kind of like you to listen, use it when it's really necessary for you to, and then kind of back off from it.
Masking is a sound in the background so that you don't hear that ringing or tinnitus, that sound as much, okay? That's what we mean by masking. You're masking that sound, okay? And remember, tinnitus can be a bell, like tinere, like they talk about in Latin. I've heard it as a train, a refrigerator,
Crickets, bells, whistles.
And that doesn't mean you're crazy. Everybody can hear it a little different, okay? And it just is different. Again, that makes more sense if you think that it's more brain and ear, not just one. Does that make sense with that part? Okay. And so behavioral therapy, that's where they try and train your brain not to pay attention to it. Medications, antidepressant, anti-anxiety. I've never prescribed any of those medications for tinnitus, okay? They do, okay? There's someone in our ENT field, ear, nose, and throat. I did a pediatric fellowship and a little ear fellowship. There are some people in our field that just do ears, okay? They don't do tonsils, they don't do noses, they don't do necks, they just do ears, okay? And sometimes, in the severe cases of tinnitus, we'll refer to someone like that called a neuro-otologist. Otology is ear, oto, and they may do it, but the vast majority of general ENTs won't prescribe things like that, and I don't know how effective. Have you seen them?
It can be effective for people who suffer with that. So, for instance, if you have an undiagnosed anxiety disorder, your tinnitus or your tinnitus is going to be worse because you're anxious, you're stressed all the time, you're always scared. I've had pediatric cases where I've had kiddos with really high anxiety, and whenever they had an anxiety attack coming on, their ears would just ring and wouldn't stop ringing, and they couldn't hear anything anymore. So in those cases of people who kind of have a combination of ringing, but either clinical depression or anxiety, I have seen those be effective just because the ringing is there, but it's worsened by when they go into, especially with kiddos, when they have their anxiety attacks or they go into depressive episodes. Being on those medications can help relieve a lot of it to where they can manage it a lot better. because that ringing can cause you to be severely depressed, and it can cause you high anxiety in a lot of cases.
But in that kind of situation, if you're seeing an ear doctor, you have that kind of illness, and you have anxiety and depression, you're going to get a psychologist, psychiatrist involved before you do that to make sure you're on top of the whole thing. So it's really rare. It's just another thing that can be done with that. So I put here, be careful of remedies, okay? Because we're not treating the cause. We don't know the cause. We are treating the awareness of the condition. Okay? All these things, when we're looking at this, not treating hypertension, TMJ, the things that we know are, TMJ causes the tinnitus, so we can fix TMJ. We're not sure what it is. We're talking about the hearing loss, the common one we really see. We're just treating that, the awareness of it. We're not actually doing that. So why is that important? There are plenty of things you will read about in magazines, you will see on TV, you'll go to the grocery store and you'll see, you go to the drugstore and you'll see. They're all over like that. None of them have been shown to be any better than a placebo, than doing nothing with that, okay? That doesn't mean they don't work in some people. That's not what I'm saying. Just be careful with your money, all right? Because they haven't been proven to work. They work in someone. That's why they can do that. It's just, I don't know which ones those are, and you just need to be careful with that if you decide to do it. Does that make sense?
Yeah.
So there is potential help on the horizon. There's a company called Lanier that has come out with a apparatus that looks very promising with this for tinnitus, all right? It's an Ireland-based company, and it's a bimodal neuromodulation. I'll get that. It's both sound and electrical stimulation. It has been FDA approved. It's fast-tracked. It's been FDA approved, all right? There's one study. The company puts this on their website. You can look at it other ways, okay? But you always have to say, okay, so it's on their website, so obviously it's positive, right? They're not going to put a negative. But it was a decent study. They looked at 326 patients over 12 weeks, 80% reduction in their perception of the tinnitus with this, okay? And it lasted for 12 months, all right? Studies over 12 months, they don't have anything like that. So what do we know about it? It's neuromodulation. That's not a new technique. We use it for migraines and seizures. So this isn't something that has never been done before with that, okay? It's an electrical or magnetic stimulation. In this case, it's electrical, and it modulates aberrant neurons. So what they're basically saying is like, hey, we're pressing a reset button so that your brain doesn't keep doing this cycle. Okay with that, You know when your computer goes down and you turn it off and you turn it back on and it works again? It's like, I don't know what I did, I just turned it off and on. We're kind of think we're doing that. We're interrupting this pattern that the brain's got in, and then all of a sudden, oh, I don't have to do that, and it's reset so it doesn't focus on that, making that noise or the perception of that noise with that, okay? And so it's altering the brain activity in the region of the auditory region of the brainstem, the midbrain. Bimodal, you have to have sound put in the ear. That's where Dr. Carly comes in, because they have to set it right. And you have this thing on your tongue that has the electrical stimulation. So it's bimodal. It's two places that you're doing with that, okay? And that allows it to do this reset, okay? This is very new, limited availability. I don't even think there's a place in Texas yet to do it. Maybe in Dallas, but that's the last I heard of it like that. It's really new. You have to do it 36 minutes every day for a minimum of 12 weeks. Okay, every day you have to do that. You don't have to do the 36 minutes all in a row. A lot of people do, but you have to do it for that time period with that. We talked about the good results at 12 months. It's patient specific, so you just can't, say, oh, this is great, I'll buy it off the shelf and put it on. They have to set it to it with this, okay? It's a cost to it, $4,000 for that, starting out with that, okay? And I think that's equipment. I don't know a lot about this. We're not doing this. I don't know anyone in the U.S. that is doing it yet. Again, it's based in Ireland, but you might hear about it, and it has good data so far to say that it might be a possibility of that, okay? But this is really, really new. I don't have any more. You know as much as I know about it right now, okay? 466 million, okay? That's the number of people that have severe hearing loss around the world, okay? And that means they cannot hear speech of a person talking at a normal level, like we're talking right now, and only hear some loud sounds. And that's just a general definition, but that's what we're talking, 466 million people on this planet Earth. So it's a big problem, okay? And there's a significant hearing loss in 1 in 3 adults over age 60, okay? It's the most common physical handicap in the industrial world, and it's probably the same in the non-industrial world. It's just we have no way of studying that with that. And then if you're over 70, half of us have a significant hearing loss with this, okay? And then you look at kids, 1 in every 1,000 children, a child is born with a significant hearing loss. It impacts their life.
And I would also like to add, just with hearing loss, it's one of those things that's known as a hidden disability, meaning no one can tell that you have it. So a lot of people will go around and, like, say you're at work or you're even at home, and people go, well, why can't you hear me? Don't you understand? I asked you to grab this. And that can cause a lot of distress for people. And the most common thing, kind of like he says, is, well, I could hear you if you stopped mumbling. I could hear you if you just spoke louder. So it's just one of those things that's there, and a lot of people don't even know they have it until you come to us and we do a hearing test, and then I have the pleasure or the unfortunate pleasure of telling you, hey, you have hearing loss. And so that's a lot of people's first realization of when they actually have it.
With the young crowd, do you find that you have more that have hearing loss at a younger age because they've been going to loud concerts?
It's going to get there. We don't have the data yet to say that. I get on my really large soapbox every time parents come in with a kid and talk about the iPods, the headphones, and how to take it like that. And Carly does the same thing. It's going to be, another 15 years or so. Hand my card out on every street corner, and I could be doing implants all the time because it's going to get there because it's just so ridiculous with that. But I'm not aware that they have that yet for the data to say that they see this big, that it's going younger and younger. And you might know that.
There is a little research kind of showing that people are, it's not necessarily younger and younger, but people are starting to notice they have hearing problems earlier, just because there's a lot of loud music. Kind of like he said, we're still waiting for people to grow up to be able to kind of see that, because what, in essence, is like what 22-year-old's gonna go to a doctor and ask to get their hearing checked? A lot of times that they don't. But that's something that is kind of there with that, and that is something that a lot of audiologists are going into schools and just kind of talking about, for the sheer fact of a lot of people just listen to really loud music. I mean, when I did school talks, I would have kids walking past me and I could hear their music, like all the lyrics, everything to the song, and I'm like, oh, I know that song. And in the car, so it's just something that is there, but we're still kind of waiting to see when that'll start to happen. And did you have a question,
Yeah, are
sir?
there gender differences in these relationships?
Males are more common than females with that, okay? And I don't know if that, I did not look that up, and I don't know if that's decreasing. A lot of it was work-related because of heavy machinery, guns, that's Texas, but they looked at, but it was more the kind of work that they were doing with that versus anything to add on that?
Yeah, with kind of what he says, a lot of the research, so men are more common to have hearing loss, but on the flip side to that, women are more common to do something. So a lot of times with women, when women have hearing loss, they're more likely to get hearing aids, things of that nature. When, and then the research shows too, when men have hearing loss, they're more common to go and say, okay, I have hearing loss, but wait on it. And go, well, I don't need something yet. So,
Studies have shown that men are very hard-headed.
yes.
She's married too, so that's what she's trying to say. I'll just go right out and tell you. So there are 3 types of hearing loss. There's sensory neural, that's when the nerve is not working well. That's going to be behind your eardrum and that bone, okay? So that's the nerve going to the brain. Then there's conductive, you're having trouble conducting the sound to the nerve. That could be the eardrum, could be the ossicles or those little bones. It also could be fluid in that space, so the bones like that fluid, kids with an ear infection with that, or if you've ever had an ear infection, but it also could be the ear canal. You put your fingers in there, that's why hearing protection works. We're blocking the canals. We're not blocking the nerve, we're not blocking that's the whole point of ear protection, we're blocking canals. So wax, cerumen, can be a cause of hearing loss. Anything in that is conductive and then sensory neural. And then the third type is when you have mixed, that you have a combination of both. There's something wrong with the canal, with the drum, the space behind the bones, and the nerve as well. So if we look at this, we've got, and this is like 2010, you know, with more, but you have 34 million people with hearing loss that could be helped with that, all right? Of that, 25% are having, have hearing aids, okay? And probably that 25%, 22% is females, because we're hard-headed with that. Hearing aids do not help in another 2 million people, which goes about implantable devices and stuff, which we'll talk about with that. So that's people, that's 2 million people right off the bat that hearing aids don't help, that we're missing, that we can help with that. We have the technology to help with that, all right? Research also suggests that there's an association between hearing loss and cognitive decline. I am not saying it causes dementia, okay? Or Parkinson's or anything like that. There is data saying that our sharpness, our mental acuity goes hand in hand with our hearing, okay? And when we treat that hearing loss and we stay on top of it, that can slow the development of cognitive decline or help our sharpness. Anything you want to add?
Yeah, and kind of with that, like Dr. DeJong was saying, it's the sharpness, and that's really because I've seen it all the time where I've worked in different types of environments. I've worked in nursing homes, things of that nature, and I've had patients that people said, oh, they have early onset dementia. They didn't. They just couldn't hear people. So how can you repeat or do something that you had no idea what someone was telling you to do, or remember something that someone said, you didn't hear them say it? So a lot of those things are kind of associated with that, and kind of as he was saying too, our brain, we're naturally designed with hearing, right? Unless you were born deaf, most of us here were born hearing, so our brain is around that, it likes that, and that's normal for it. So any type of thing that throws it off balance or makes something abnormal, it does not like that. So the brain is really, really good at using it or losing it. So if it uses those pathways, you're good. If it stops using those pathways, the brain goes, why should I waste the energy on it? And diverts things elsewhere. And that's where if you leave hearing loss alone for an extended time, there has been signs that you can decrease clarity, meaning that even if I provide you with hearing aids and stimulation, I don't necessarily, there's not 100% that I can bring clarity back because the brain has already started to divert those pathways to other places.
By clarity, she means the difference between, did they say were or was, where, what? You know, that you heard a noise, you know, they could have said it in Spanish or Chinese, and if you don't speak those languages, you heard it, you didn't understand it, okay? Clarity is the ability to understand it, discrimination ability with that, okay? But it's more than just not hearing a sound, okay? Why do I want to really bring this up, okay? Because as you work with yourself or family members, okay, there's more to it than they're just missing what's being said, okay? What I want to try and start getting across to people is that this is really important, not just because you're missing music or you're missing what the grandkids said or you're missing what your wife or your husband said. It's your brain. You're not new. Probably in this audience group, you've known 1 or 2 people that have had a stroke, all right? And if people really get on it, depending on how severe it is like that, and they lose some ability in an extremity, if they go to therapy, if they use it, they can get it back, okay? So if we continue, if we stay on top of this, it can really help the cognitive thing that we're so focused on now that we hear so much about with that. Does that make sense? So, what are our options for that? Hearing aids. So we have hearing aids, something called a bone-anchored hearing aid, and a cochlear implant. We're going to kind of go through things with this. And we have samples of those so you can kind of see what we're talking about besides just the slides with this, okay? So first-line treatment is hearing aids. Advancing technology, decreasing size. There are also some implantable hearing aids. I don't do those. Completely different talk. I just want you to be aware that there's something like that, okay? So how does a hearing aid work? All it does is take those sound waves, it picks it up in the hearing aid device, and it amplifies the noise, okay? So it just makes it louder. That's what a hearing aid does. Now, a good hearing aid, something that Dr. Hall will do, okay, is specific to the frequencies that you're missing, and there's more to it than just amplifying all of it. Carly, you want to add anything to that?
Yes, so that's something that is coming out a lot because the FDA just allowed for over-the-counter hearing aids.
We'll get to that here in just a minute.
Yeah, but they do a lot more than that. What they do is they'll amplify what you need to hear and decrease what you don't need to hear. So that means when you lose hearing, your brain loses the ability to distinguish sounds. And what I mean by that is a lot of people will complain that if they're in a noisy environment, everything blends together. But if you're a normal hearing individual and you're in a noisy environment, we could have a conversation and I could ignore all of you in the background and just be able to talk to him. When you have hearing loss, you can't do that because your brain is stressed and trying to grab everything that it can and funnel it in. What it does when it does that is it gets confused because now it has no idea what it's supposed to be listening for. It just has all this noise and goes, okay, I don't know what to do with this. What hearing aids do is it gives it that ability for you to notice that things are behind you, but still be able to focus on what's in front of you. The goal of a hearing aid is to try to mimic natural hearing as much as possible. I don't want you to not hear the background noises because you need to. What I want you to be able to do is hear it and ignore it and focus on what's happening or what you want to listen for.
So how does the hearing aid reduce the ringing in my ear, like the tinnitus or tinnitus is what?
Yeah, so kind of what it does is it gives you access to sounds that you haven't heard in a very long time. So it's activating your brain in a normal manner to where your brain isn't needing to make a phantom sound. It has sound to where you don't perceive it as much. I'm sure if any of you have ringing, if you're really busy and you're doing all this stuff and you're moving from here to there, you don't even notice it. It's just in the background, but as soon as you sit down on the couch, you take your shoes off, you relax, all of a sudden you go, there it is, now I'm annoyed. But what the hearing aids do is it keeps you drawn away from it. You're hearing all these sounds, you're hearing the TV, you're hearing the air conditioning kick on, you're hearing that your refrigerator stopped working. Those sorts of things are what kind of help drain it to the back because now your brain has everything else to focus on.
The other part of that, though, is I think the follow-up to your question is that it has shown to help even when you take the hearing aids off. Hearing aids while you have them on, which I think that's part of your question, is I think it's part of that, you know, when I talked about the bimodal stimulation, well, it's not bimodal, we're just doing the hearing part, but that's enough that it starts retraining the brain and the hearing system to say, hey, I don't have to focus on that, okay? So it's only one step of that Lear system, okay? But it's partly doing that, it's retraining a little bit, just keep stimulating with the correct sound, and then your brain, you're relaxed a little bit with that. Now, is that anywhere in the book? I think that's what's happening, okay? It's you're doing that kind of neural training just with the sound. You're not doing the electrical stimulating, you're just doing the sound. That's the other part. That's why it works over 4 months. So they're highly adjustable, and you have the connectivity. You've got decreased size, various colors, lightweight. There's really nothing to them anymore. They're programmable to your phone. They're digital world friendly, okay? So you can hook them up to all the bells and whistles you want. You don't have to, but you can, okay? So rather than, you know, in the phone, hitting the button so that it goes to, you know, Bluetooth here or speaker, they can program it so it goes right to your hearing aid. You know, they can do those kind of things with that. So anything to add on that stuff?
Yeah, I always like to say this because that's a lot of my younger generation, they go straight for that. But I always like to say that is just a luxury of living in this age. The hearing aid's main goal is to help you hear and to hear clear. So a lot of people will go in, or like I've had it happen a few times, or a lot, where they go, well, it won't connect to my phone and I don't want it. And I go, well, can you hear this? Can you hear that? Yeah. That's why they're there. These are things that are helpful, but they're not necessary for you to hear. There's just, like I said, it's just an added luxury that we made to make it easier. Their main job is for you to hear. So if you feel like they are working, but maybe they're not as easy on the phone as what you'd like them to be, it is just the secondary feature. It's not their main feature.
But in the same sense, when you're working with that hard-headed male, all these things can line up to say,
Yeah.
oh, it does this, oh, it does this, it makes it easier. And if you can free a hand up in the car and you can focus on driving, that helps. And so the other thing, what I'm saying is that they can do things and you get what you pay for, but they can do other things than just, help you hear with that. And they work with our digital technology to help with that. That's the point. Okay, so the average cost was $4,500 in 2019, okay, for a set of hearing aids with this, okay? And I'm not talking the high end, I'm not talking the low end, it's just average cost. So you're gonna spend $4,500 on this, okay? In 2017, they went with the over-the-counter OTC, it became a law. Prior to that, only doctor of audiology or what's called a dispenser, that's someone they may have not gone to school as long as Dr. Hall has, but they just fit hearing aids, okay? So that's all they do, they just fit hearing aids. An audiologist does other things besides that, but that's only who could do it before then. Now, they've made it more accessible, they're self-fitting and self-adjusting and more affordable, with the average pair about $1,600 with that, okay? There are some drawbacks with these over-the-counter ones, okay? Mild hearing loss, moderate hearing loss, those are what it works for. They are not for severe hearing loss with that, okay? They're usually, now the way I've said it, a pharmacist, because they're at a drugstore, assists you in doing that, okay? To say, hey, try these. They're getting some extra training, which it seems like they don't mind doing with that like that. And then the other part is you have to self-fit them with that, okay? Again, I want to emphasize they're not for all hearing problems with this, okay? Would I love if everyone got to see a doctor of audiology and really look there and got all of that? Yeah. Do I completely get $4,500 as a bunch of money? Do I also hear all the time like, well, I tried hearing aids and they just didn't work as well as I wanted like that? Okay? All the above, okay? This is just another option, just like I talked to you about the over-the-counter things for tinnitus. You've just got to be careful with your money with this, okay? You know what I mean? And you've got to make sure what you're getting for that before you do it with this, okay? Have they checked your ear? Are you full of wax? Is it going to fit right? You know, all these kind of things, but those are or things that you have to do on your own, okay? I think there are huge advantages with someone like with Carly's education that can help you in ways and adjust it much more better than, more effectively than an over-the-counter one.
And I always like to tell people a lot of the pricing in audiology with that is you're also paying for me. So you're paying for all of my 8 years of schooling, you're paying for my expertise with this device, and you're paying for just me to help you. So if you need them cleaned, I have people who can help you clean them. If they're not working for you, I am a very handy person. I can figure out how to fix them. If they're not pairing to your phone, I specialize in IT, so I can help you with that. So there's a lot of things that I just have knowledge on that I'm willing to assist and help with. And a lot of times with over-the-counters, kind of like what Dr. DeJong was saying, they are really good for people with mild hearing losses. But again, a lot of that's for flat. And what I mean by flat, it's a hearing loss that is just a line. Majority of people have a line and then a slope. It just makes things loud a lot of those times. So for people who might have a little bit of a severe hearing loss where you start off with your line and then you drop down drastically, they're not really going to help you. A lot of my patients who do over-the-counters come in and they let me know, this was a waste of time, it was a waste of money, and they didn't help me at all. And they have a very negative experience of hearing aids. So it's kind of letting you know that with these, kind of like how he says, you do get what you pay for, but they open up the market to a lot of people to know, oh wow, this is what I'm missing out on. And when they kind of can't help anymore, I can help fill in that gap to where I can get you into something that will help you.
It seems like if you're not evaluated to begin with, you don't know where to start.
Yeah, it's kind of like
all the
cheaters.
things you're describing is like, I don't know, you know.
Yeah, it's kind of like when you wear cheater glasses, you wear them and then all of a sudden they stop working, you go, dang, I gotta get my eyes checked now. It's the same thing with hearing aids. You can only wear them for those for so long before you go, well, these just aren't working anymore. Maybe I should try to go see a specialist, and that's why we're here for that.
Yes, yes. Why do we do it backwards? But that's right. You're right. It's not. It may not be the hearing aid. It may be you need to have a good evaluation.
Well, the other part of this too is that if a hearing aid is fit appropriately, it will not make you lose more hearing.
Yes.
Okay? It won't.
Okay.
If it's so that's a myth. It says, well, if I'm amplifying my hearing, it's just going to compound it, and I'm going to have more hearing loss sooner. So I'm going to do it. Again, mostly guys. But the thing is if it's fit appropriately, they're not doing the frequencies that don't need help. Okay, that's what you can do. Now, you potentially you could get in there with the over the counter that you aren't fitting it right because you're doing it yourself and you don't have that expertise. Okay, they have built-in safeguards to help you with some of that like that. But still, the point is that to start with someone that knows what you're doing. Okay, but that still, I'm putting these things out here. These are your options, and you have to do that because $4,500 is $4,500.
Yes.
$1,600 is $1,600. Okay, so I don't matter how many times we have this conversation, that's still a bunch of money. All right, okay, and I get it, and you guys have to decide all that kind of stuff. So, well, you spent a bunch of money on these things, and these things don't work, right? Okay, what do you do with that? Okay, well, the first thing I want you to do is you go back to wherever you were, and you go, why? Has my hearing changed? We saw a lady today that she had hearing aids and they were doing well, and then about a month and a half ago, they just weren't working. Well, her hearing loss had increased, and she needed to have them adjusted, okay? So that's another thing that an audiologist can do for you. Now, I don't know enough about over-the-counter hearing aids that you bring them in and say, well, this wasn't work, you can trade it in. I don't know, I don't think so, but I don't know. But that's another advantage of someone to do that, because that'll happen.
I also like to say with hearing aids, just because I've done it for a hot minute, that a lot of people tend to come in with hearing aids with unrealistic expectations. And what I mean by that is people think hearing aids are like glasses. You put on your glasses and I see. Hearing aids aren't glasses. It's not a lens that I'm correcting. A majority of the time, as we discussed, it's nerve damage. I can't make a nerve work fantastic again. I can't do it. But what I can do is I can help it along. So I can make things better. Things will never be perfect. There might still be environments that you genuinely struggle in. But I also like to say, I struggle in environments. If we ever go out to a karaoke bar, I can't hear my husband and he's right here yelling at me and I'm like, I don't know what you're telling me. So I don't expect someone with hearing loss to be able to do that. So that's something to keep in mind. They're going to help. They will make things easier. You'll notice that in conversations where you tuned out, you don't have to do anymore. I had someone who said, well, I don't think they're for me. But then they came back and said, well, for the first time in like 6 years, I was able to sit at a family gathering and talk to people, where normally I just sit in a chair, wait for an hour and tell my husband I want to go home because I can't talk to anyone and there's no point in me being here. So you have to kind of keep that into your mind that they're going to help. It won't be perfect, but it'll be better.
So the ENT and the audiologist should go through the hearing test, your audiogram with you, because there are certain signs to say when a hearing aid has a really good chance to work and not. But everybody's so individual that even though the numbers may say this, you still have to try because you don't know for sure. Okay, but I tell everyone that comes in for hearing aids is that this is not the best thing since sliced bread. And then I usually say, you know, like if you're going and shopping for a new car and you make a ledger, I really like this car and I really like this one, so I like these features, I like this. You've got to do that with a hearing aid. Say, when am I having the most problem? Can it help me in those situations? Because it's not going to help you in every situation. And I try and tell you, the more competing noise, the louder it is, the less effective our technology is compared to what you were born with. We just can't fix it. So the more competing noise you have, you're not. And so if you're in a loud environment all the time, I tell people, don't go back and see Dr. Hall because it's not going to work for you. You have to do that. And then the final thing I tell them is that this takes time. Okay, you have a month to try and get your money back, except for like a fitting fee and things like this. Okay, but you need that month because you got to knock on the door and say, I need this adjusted. Okay, because they'll adjust it, but there'll be those things that you say, well, it's not right here, or this is wrong, and it just takes a while. Plus, getting used to wearing something in your ear. Just all that takes time. Okay, those are the things that I always focus on people, because if you go in there and say, I want my hearing that I had when I was 20, don't do it, because you're just not going to, we don't have the technology to do that.
Mhm. I don't have the technology to bring a nerve back. Once it's gone, it's gone. As of right now, you know, science hasn't.
But
gone
I'm
yet,
getting
but-
real close, I do.
Yeah, got it.
And that's where the implantable technology is here. And that's when, if anything I want you to tell me is that I don't want you or your family to give up. There are things we can do to almost everybody that has a hearing loss, irrespective of the age, okay? And hearing aids aren't for everyone, okay? There are criteria, which we'll go through and stuff like that, but there are options, okay? That's what I want to get, okay? We want you to hear, that's number one, but the second thing is that there are options, okay? So, there's something called a bone-anchored hearing aid, or BAHA, okay? It's different than a hearing aid, okay? Now remember, overall, a hearing aid amplifies the sound, and it should do correctly with this. A bone-anchored hearing aid is an osseointegrated auditory implant, big words, okay, that restores the perception of bilateral hearing with that. And she can press around, or you can look at it with that, okay? It's not a hearing aid in the traditional standpoint, sense of the word. There's a newer design compared to the old ones, and so it's all our skin. We'll get to that. It does involve a surgical procedure with this. It's for conductive hearing loss. It's for mixed hearing loss. It's also for single-sided deafness, where you're fine in one ear, but the other ear is dead. This can help you, all right? There's also a clinical demonstration, okay? So I say, Dr. Hall, I think this is a BAHA candidate. She says, here, put this on and see what you think.
And that's what I'm passing around. That's known as a soft band. What that lets me do is put a headband on you and you can listen to it. Soft bands are very widely used clinically because there are children who have pretty bad conductive hearing losses. And when you're really little, like 2 or 1, like one of my kiddos was, I can't just put something in your skull. Your skull is still really soft. You're still a baby. So we have soft bands for that, and that lets adults demonstrate and see what the technology is. Now, I will say with the soft band, especially for bone anchored devices, you might hear it squeal a lot. That's just because it's not snapped. It's not centralized and grounded in the head. It kind of just like if you turn your head really fast, or if you're like me, you have a lot of hair, it kind of slides, and then you might hear it go, and you have to just resituate it and it sets.
It's a demonstration. The implantable part, which I'll show you in a second, is about 15 to 20% better than the band itself.
Mm-hmm.
So what it does is it bypasses the damaged part of the ear, either the nerve or the conductive part that we talked about with this, okay? It'll take that sound, and here's the implant, and that's just a gross way it looks on an older one like this. But let's say this ear was completely dead, okay? It will go through the skull and stimulate this one. Now, what's really cool the way our brain is made, and if you ever seen those pictures, you know, like scary movies, and they'll have a deer in the forest, you know something bad's gonna happen, right? But the deer like will turn one ear as the sound's going like that. We do the same thing. We have directional component with that. Now, we don't have, most of us can't turn our ears like this, okay? But there is a split millisecond difference between the sound giving to my left side and my right side. Our brain uses that to say, that sound was on my left side in the back, and I can have directional thing. That's why we want 2 ears with this, okay? This takes advantage of that. When it stimulates that, either into that cochlea, so it's using that ear, you know, that, but if it's a dead ear and it can't use it, you're not hearing like that, there's just that little separation of difference, and so your brain will go, well, that came from the other side. It won't get confused. It'll give you stereo back with that, okay? And so this is the implant. This is the part that goes inside. This is the external part, and they're put together by a magnet. This is a magnet, and this attaches on the skin here with this, or underneath the hair. This takes the sound energy, stimulates through the brain and the processor here, and then that gives you the stimulation on the skull, which gives you that sound with that. And so this is almost the side that she has ones going like that. They come in different colors. It attaches magnetically, and it's usually hidden by the hair Here's one, you can barely see, it's her hair color, but she could cover it by the hair want. Here's his over here, I wish they would have turned them, but, you know, it's a small device on there with that. Carly?
Yeah, a lot of times the Ossia is the newer version of the Baha. So Baha bone anchored hearing device. But the original one is the one that I passed around. That's the one that you'd be able to test in office. The Ossia, I don't have the capabilities to because it's a magnetic system and that it sticks to the magnet, and then the bottom part, which was, if you go to the slide where you can see it, this part is the stimulator.
Yes, and this is the part where I put the screw into the skull, and that holds it, and this is all underneath the skin.
Yes. So for that, the only reason why I brought that one is because that one can be tested here. They will sound the same. I'll say the Ossia has a little bit better of a sound quality just because it's newer technology, better learning programs. And by learning program, I mean all hearing aids or Bahas or cochlear devices are actually made with AIs in mind, meaning that there's a computer program that is able to listen to your environment and go, you're in a restaurant, you're in quiet, you're in a small room with noise, you're here, you're there, and it auto adjusts itself and listens and figures out where you need to go. So all the technologies can do it. Now, are they perfect? No, that's why you have manual control on there. As like my dad always tells me, because he's nosy, he'll be talking to me and there'll be people fighting in the back and his hearing aids will go to that and he goes, I'm like, are you listening to me? He's like, no, they're fighting. They're going to get a divorce. Oh my gosh. I'm like, stop listening to them. Don't do that. But in those environments, that is a complaint that a lot of people have. It goes, I hear everyone behind me. If there's someone loud 2 tables down, I hear their whole conversation. The hearing aids are smart. They're not people smart. But that's where your phone and programs come to where you can override them and focus them in more.
So they'll have different programs, okay? So I'm at a concert, I want this, okay? I'm at dinner with my significant other, I want this, okay? With the grandkids, I want this, you know, things like that.
There's also a mute feature. I don't recommend you use that with your spouse or someone who's yelling at you. You will get in trouble. I've had friends who have done that, and which Dr. DeJong will go on. I have a really good friend who has a cochlear implant, and when he didn't feel like listening in class, he would unhook it from his magnet and fall asleep like this, and the teacher would just slam his arm down, and he'd go, whoa, don't do that, you'll get in trouble for that.
I'm meant to show you, like, if you put a tuning fork to your head, and you hear that sound in the skull, that's what this technology is, a bone anchored. It's that tuning fork. If you put that, you know, if you hit a spoon hard or something like that, and you put it up, and you kind of hear it in your skull, that's what this is based on, okay? That's the osseous. It's stimulating the skull, which then will vibrate the inner ear, which will give you the ear.
And think about talking through tin cans too, how if you have the string and someone and you can talk and they can hear you, it's the same. Your ears, the skull is a vibrator, meaning that the sound that hits here comes to both ears. So if one ear's dead, if I even stimulate that side, the skull will naturally bring it over here.
So the last one we'll talk about is the cochlear implant, okay? And this can restore the perception of hearing. So I can trump her because I can actually help the nerve, where she can't do that. Okay. And it's both for adults and children's. Children, she'll show you about it like this.
This is a kid's color, but you can get that color too. I can do pink, I can do red, I can do purple.
There's an internal package here with the electrodes. I'll show you that a little bit. And then there's an external component to here. So for hearing aids, you know, they're small, but you'll have something external. For both the bone anchored hearing aid
This
and
is
the
the
cochlear implant,
internal
you have the
package.
external part, because that's how we gather the sound, right? Okay, at least at this point. So
And these are
this
two
talks
versions
about
for
when
adults.
hearing and who's a candidate for an implant. The biggest thing I want you to understand is that when hearing aids don't work, go see Dr. Hall, because she can tell you when you're a candidate, when there's a possibility this can help. And these criteria are changing all the time in terms of the recognition of your scores or things we look at, and they're decreasing all the time. We are getting almost as good with our implants as hearing aids. I know she didn't like to hear that, but we're almost at the point where we're going to say, just don't hear it, just let me implant you. Okay, not even, but we're getting that good with the technology.
Yes.
So it's an outpatient procedure. It's not brain surgery, okay? It's usually for severe to profound hearing loss or that single-sided. You can do a Baha or you could do a cochlear implant. And again, criteria are continually changing, they're being updated. We're finding that we're doing better. So before it used to be you had a profound, no hearing there whatsoever, okay? Now we're at this speech recognition of what they call 60%. When you're below that, then we can do better.
Yeah. And a lot of the reasons on why the criteria is getting lower and changing is, I don't mind if we do implants. I love implants. But the secondary part is, it is a lot easier for your brain to get adjusted if it still remembers what sound is. Meaning, if you still have 60% hearing, your brain knows what language is, it knows what it sounds like, so it's a lot easier for it to relearn how to do it. Implants is a completely new game, meaning I can't tell you how you'll hear because I don't have one. So I do not know what it is like. Everyone will tell you something different, everyone is different. I can tell you that you'd be successful or you have a higher likelihood of being successful, but it's never 100% with implants. But what we found is even with someone that we've implanted who had profound hearing loss for, I think like 20 years, they have access to sound again and they can understand speech, which they haven't heard people's voices in years. They've only relied on lip reading. So now they can go, I hear when my coffee maker dings. It scared me when I heard it and I had no idea what it was. But for the first time in 20 years, I heard that sound. Or my favorite one is he said, for the first time since I was little, I could enjoy music again. I've never been able to hear music, understand music, anything. But now I can actually listen to the songs I used to like and be able to understand the words there. So that is what an implant can do.
So unlike a bone anchored hearing aid or a hearing aid itself, okay, you have to learn to hear again with the cochlear implant, okay? The electrical stimulation will go into the inner ear. So you have the external processor that gathers the sound. It will take that to the internal processor, okay? And that converts it to electrical signal. It goes into the cochlea through this wire, which then stimulates the nerve directly with this, okay? This is the cochlea where you have the little hair cells, the small little keys like on a piano that say that was an A, that was a B, and they can tell you, or a C minor, and can tell you what you listen to. I've completely blown that up with this electrode, and it will stimulate it, but your brain has to go, wait a minute, that was just an A I heard. I didn't know what that was when I first turned this electrode on, and you have to practice, and then the brain goes, okay, that's now what an A sounds like, and then you'll get that. And so I've heard people say music initially sounded tinny, you know. One lady described it like she said with those, you know, talking with the cans. But the more they used it, the better it got to where it was like they remembered how the music was. So there's a learning curve with this. And so this isn't the same thing like you put your Baha on or you put your hearing aids in and you learn. You've got to work with this, okay?
How old is this technology?
How old?
How old? How?
Well, the first one was actually, I have another talk on that, was done I think in the 70s.
Okay.
And actually it was a cart you had to carry around.
Oh my goodness.
Okay? I mean, if you think about the first artificial hearts and stuff like that, you know what I'm saying?
Sure.
It was the same, they had to have a cart to carry around and stuff like that, okay? So here's the implant, okay, underneath the scalp, but here's that electrode that goes into your, you know, so that's how, look, here's your eye, here's your nose, and that's how the electrode goes in there. Okay? And this is the external part. They have some now without the ear part, just like the bone anchor that just fits right there, so you don't have to have that if you don't want to. Again, those are bells and whistles depending on what you want. So, there's a lot going on in the world of hearing, and we talked about some of the stuff that may be down the pipe for tinnitus, okay? Remember, hearing loss can be a serious problem, okay? I didn't really go into this, but there is a social ramification, you kind of mentioned it. It can be misdiagnosed as dementia because people withdraw, especially the guys, and they just sit in the corner because they get so tired of saying huh or what, and so they just give up. It's just not worth it anymore with that, okay? And there's no way if you hear you can understand this. Man, just try. Why you do it? if you do that every time you have a conversation and your partner or your kids or your friends don't understand, at some point you're just exhausted. You just can't keep doing it. And so you just withdraw. Okay? So it really can have serious social ramifications with that. And we are social beings with that. Okay? We often deny the problem, okay? Because we know when we can't see that sign at 9 years, I gotta take my glasses, I'm having trouble with that. We will make 1,000 excuses why we didn't hear. You're mumbling, whatever with that. I'm a guy, I'm not supposed to. I mean, whatever, it's all that kind of stuff. So that's where friend and family are really helpful. I can't tell you how many people, almost every guy that comes in with his wife, I'll go, and it says on there hearing loss, or it says like, worried about hearing. I said, okay, so what is she complaining of? Because the guy's not going to tell me, and they both laugh, and then she says, well, he's not listening, blah, 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 and stuff like that. So other people really can be, attuned to what we don't know, we missed it, just like Dr. Hall said. Okay? This is going to be less of a problem as we go farther along, because if you guys think, if you were walking down the street 20 years ago and someone had those iPods in, you thought maybe they had some earmuffs, but they were talking to themselves, you'd go, okay, they are crazy, man. What is going on? They're having a conversation, blah, 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 blah. And now we just take it for granted. If you go somewhere and they don't have it, it's all right there, right? And they're talking. 20 years ago, we thought they were crazy, okay? So we're getting used to seeing things in people's ears much more than we used to. So, people wear glasses as a fashion statement, right? Okay? I mean, they'll put glasses on that they don't even need because they look cool. I mean, we all have those things that we do with that, okay? Maybe not this age group, but younger they'll do that with the glasses and stuff. We're getting there with stuff in our ears. We're just not there yet with that because it's still not cool to hear as well as we want to. Big thing is that ask if you think a relative has some or a friend has something, because there are a lot of things we can do. Okay, I'll just end with this is a really cool lady. She, Connie Ferguson. She was the deaf ed teacher here with this, and I moved here from Houston. I was at Texas Children's and started an implant program and stuff like that. And she made an appointment. She didn't have a problem. She just made an appointment with me. She says, I know why you're here. I went, ma'am. She says, I don't believe in implants, and you're not going to implant any of my kids. Yes, ma'am. So I'm not here to change any minds or anything like that. Okay, so I don't believe in this, and I used to make rounds, and because a lot of these kids that have implants in Houston or Dallas, but they didn't have. If you're doing kids, and I don't do kids here really anymore, because you need the whole program. This isn't like an adult. You put it on and go do the homework. And the educators, there's a lot that goes into this for kids. Okay, but I'd go to these classrooms and they'd be hanging off. They wouldn't have batteries because no one did any education on what the families had.
Right.
Yes.
Okay. So I implanted both her ears.
Wow. I love it.
And I'll kind of say with Dr. DeJong, that is still a very large part of for people in the deaf community. A lot of times what people don't realize or don't understand is a lot of people who are in that environment or have kids that are deaf and are part of that, they were treated as different than others, and it was very much, we would go through and implant them, and then if they didn't succeed, they were a failure. There's something called an auditory failure. You'd never be able to talk, you're never going to be able to hear, you're just a failure. And so that is still a lot of stigma within that community, because to them, there's nothing wrong if I can't hear. We're the weird ones that can hear.
Well, it goes farther than that, because then they think they're hybrids, okay? They're not part of the deaf world, okay? And there is a deaf culture,
Yes.
and we have to respect that. And with Connie, I never told her to get an implant. Her hearing got worse and worse, and she finally came to me and said she was ready because she wanted to hear her grandkids, okay? And then she did really well, so then I did her other side, and she's retired and traveled the world and have a great time, but that was a great success story. Do I have some failures? Absolutely, okay? But the deaf people will tell you that you're not in either culture. You're in between with this. It's not so much more because we're catching kids so early. I mean, they're implanting down to 6 months, okay? When I started doing this, 2 years was a real limit if you went there, okay, you know what I mean? Because of different things, but our technology is better, our ability to catch these kids, you know, we have neonatal universal screening. We didn't used to have that 30 years ago. So there's all these things, and so that's less of a thing, because the earlier you get there, then they will mainstream. What I mean by that, they'll go to the hearing culture much quicker. But before, when they're implanted later, they never could quite get their speech right, because we learn by what we hear. That's why if you see someone that grew up, you know, Asian or another culture, they, you know, or European, you can notice something in the way they talk, because you can't get that. Past 8, that's pretty solid.
Yeah.
Okay. So that's less of a problem now, but never have I talked someone into it, and I absolutely respect that, because it is a culture. Less of an issue now because we're getting to those kids much younger, but that's still a big thing.
And a lot of people just like to have access to sound. I mean, there's, I had an individual who they were deaf, and they go, I just want to know a train's coming. Because I almost got hit by one, and that was kind of scary, so I just need to know there's something there. And for a lot of people, yeah, some people do, and that was just something that he always said is, I was always scared because I can't hear like a dog bark. I don't know if there's something coming after me unless I'm looking, because I don't have that awareness. And even some individuals, there was a really long talk. I have a good friend of mine who she's unilaterally deaf and was born that way. And for the longest time, she was told that an implant wouldn't help her because she has one good ear. So why would we do anything about it? And so that affects you as a child, because you grow up and you don't have access to one side. So people thought she was bad. She just couldn't hear when the teacher was yelling at her to come in from the playground. She literally just couldn't hear her. So she was bad, because again, hearing loss is hidden. I can't look at you and see that you have it. So it's just one of those things that is just really helpful.
So that goes back to expectations, right? Okay, sound awareness. I've implanted people. This is not going to help you with your speech. They want sound awareness, and so but this is the same thing. Please bring those expectations whoever you talk to about your hearing aids or whatever it is like that, because that's the part you've got to really come across with, is that what are you wanting, okay? Because if they're honest, and Dr. Hall is very honest, is well, I can't do that. You know, that's, you know, don't waste your money because it's just that you're not going to get that, you know, from that. Versus, yeah, we can help. There's going to be some things with this. Okay, making that list of what's really important. So when you go to your hearing specialist, this is what I'm trying to call them. Can you help me with that? Okay, and sometimes you know you have to try, but that's when you try. At least you know you have some realistic.
Now, can anyone adjust any hearing aid, or do you have to go back to where
You
got
have, so it all depends on who you go see. So if you go see a audiologist who say is at an ENT practice or things like that. So for example, for me, I can see any of the name brand manufacturers, which there's 7. I won't go into all 7 because they're all do different things and they're all special in their own way. But I can adjust any of the main.
Okay.
Now, if you were to get a hearing aid from Miracle Ear or say Belltone, I don't have access to their software. So I cannot touch them. Meaning, I did have that happen to one of my patients. I was in Baton Rouge, Louisiana for a long time. And one of my patients was with Belltone, and Belltone just left. And the closest Belltone was 4 hours away. I couldn't work on her hearing aids. No one in town until she had to drive 4 hours to work on them because I'm locked out of the software. So always be careful with things like that. Belltone and Miracle Ear, I have had people who work there, and I do know audiologists who work there, and they're good people. But if they leave,
You're stuck.
you're stuck. I can't work on them. I can't even touch them, because if I touch them and fix them, say it's simple that I can fix, they'll just wipe your warranty because I touched it. So that's something to really make sure of, even in places like Sam's Club or Costco or Walmart. If I can fix it and I've touched it, your warranty will be wiped, because I've had it happen in the past, and I know of people who have done that and have had it happen to their patients. So that's always something to keep in mind. Now, when you buy from one of the main manufacturers, that isn't a problem. So for example, Phonak is Phonak. Phonak has its own warranty. The warranty is through them. So if you go up and move state and you find an audiologist and you go, hey, do you work with Phonak? She'll go, yeah, I do. Come on over. I'll set you up as one of my patients. That's kind of the positives to getting a name brand, is just anywhere in the country that you go, even overseas, because a majority of these manufacturers are also overseas, they can work on your hearing aid. No problems. I've had someone have a hearing aid breakdown in Europe, and they called someone in Germany, and the person said, yeah, I speak English and I can do that. And so they got their hearing aid fixed in Germany, because the warranty is through them. It's not through me.
Gotcha.
So that's always something to keep in mind and to ask, because the worst thing that I've ever had happen or have had that happen is, I can't help you. I can't fix this.
The
That helps me
pros and
understand
cons are you just
why.
have to be, you know, just look at it and really think through it before you make those kind of purchases. Any questions or anything that we can
I have a question. I don't have those problems. What mine is, I can hear you fine, but when in a group, then I lose I can hear sound, but the words mumble. And there's a certain pitch with a woman's voice that I can't hear.
You might be a candidate for hearing aids. I would need to see your hearing, but a lot of times that is common when you have hearing loss. In a bunch of groups of people, you do not distinguish voices. Everyone talks to you, but they're all jumbled together, and you just sit there and smile. And sometimes you might smile and nod your head at a very awkward thing. And they go, why did you nod to that? Something bad happened. You go, oh, what? I didn't know that. So it's one of those things that I...
ask your wife what they said.
But sometimes you don't know. Or she goes, weren't you listening?
Right,
Weren't you
right.
listening? Start paying attention.
Right.
But yeah, but it's definitely something to just...
they say.
It's definitely something just to come in and see, because I can tell you just from that sounding, you might be a candidate, but I never know for sure until I see the hearing
And can you
loss.
see a whole family at one time? Would that be?
Okay, so I have only done that once. I will never do it again, because everyone argues over each other, and you sit there and you go, all right, I need all of you to stop. Don't gang up on the person. Y'all are all fighting. I need all of you to step out. So I have done that once. It's a very southern Louisiana thing where you invite one person in and 10 people show up and you go, well, I don't have enough chairs for all of you, so I don't know what we're gonna do here. And then they all yell over each other, and the person is just sitting there like, see what I have to deal with? This is why I really can't hear. And you go, no, that's not really why you can't hear. So
That must have been interesting.
it's always an interesting time. But I always recommend, if you want to bring family, I have a lot of patients who come with their children or their grandchildren, and they just have someone there just to kind of help listen for them. And just, I always say, no matter what, even if someone's there, it's your decision.
Yeah.
So even if they want it, but you don't, it's your decision. They're just there to help. They're not there making the decision for you. So you're always the person who makes the choice. Even if someone is talking over you and for you, even though that's not what you want, I can genuinely read and say, I know how you're feeling, or how do you feel about this? Because I do have that as well.
And I have cards for Dr. DeJong, and I bet we could get
Yes.
cards from Dr. Hall too.
I do.
Any other questions, folks? Thank you all very much for letting us.
Thank you.
Thank you very much.